With the authority of the Council, I shall now confer the degree of Doctor of the University. I call upon the Vice-Chancellor, Professor Glyn Davis, to read the citation.
Acting Chancellor, the Council of the University has resolved to award the degree of Doctor of the University to Dr. Cherrell Hirst, AO. Cherrell Hirst graduated in medicine from the University of Queensland in 1969. The following year, she was employed as a resident medical officer at Princess Alexandra Hospital in Brisbane. During her early career in medicine, Dr. Hirst worked in paediatrics, gynecology, anaesthetics, psychiatry and casualty. After her internship years, Dr. Hirst spent 3 years overseas undertaking postgraduate studies and gaining further experience in Canada and Great Britain before commencing as a general practitioner in Brisbane in 1976. 3 children, and 6 years later, she accepted the position of Deputy Director in the newly opened Wesley Breast Clinic in 1982. She was appointed Director 2 years later. Under her leadership, the clinic grew from a small service initially seeing 4 women per day to a nationally recognised centre for breast cancer, assessing over 100 women per day and offering a broad range of associated services. In 1987, the clinic commenced Australia's first private breast screening service where all women could attend for mammographic checks. Recognising the considerable emotional trauma that women go through at the time of a diagnosis of breast cancer, Dr. Hirst introduced services to provide information and emotional support for women and their families at the time of diagnosis. This program commenced in 1990 on a very small scale and gradually spread over the decade to involve a number of services, including the Stretch program, Kim Walters Choices program, a Partners program, and a specific individual counselling service. All these services were funded entirely through donations raised by the community. The provision of emotional and information support services for women and families with breast cancer became a passion of Dr. Hirst's work and was the major feature which differentiated the Wesley Breast Clinic from other services. Her primary goal became to make the provision of support services for women with breast cancer part of the mainstream medical care. Through her work in this area, Dr. Hirst has developed an international reputation for research, publications, and conference presentations on breast cancer. She served as a member of numerous state and national medical committees relating to breast cancer screening, including the Queensland Breast Screening Program Advisory Committee, the National Steering Committee for the Program for the Early Detection of Breast Cancer, the Queensland Breast Screen Accreditation Committee, and the National Breast Cancer Curriculum Development Committee for the postgraduate medical course. She was the Foundation President of the Australasian Society for Breast Disease and a member of the International Scientific Committee for Breast Ultrasound. In addition, she has served as a director in 2 community-based breast cancer organisations, the Breast Cancer Association of Queensland and the Breast Cancer Network of Australia. Cherrell Hirst also has a strong interest in education. She decided to undertake a second degree, this time in education, a Bachelor of Education Studies, which she completed in 1989. The decision to undertake this study arose from her interest in adult learning and its relationship to patient behaviour. She was appointed to the Council of the Queensland University of Technology in 1990 and was elected to the position of Chancellor in 1994, a position she still holds. She was elected to the board of Brisbane Girls Grammar School in 1990 and was re-elected in 1994 and 1998. She assumed the chair of that board in 1996 and continues to hold the position. Cherrell Hirst's broader interests have led to her becoming a member of several boards. She is currently member of the board of Peplin Biotech, Suncorp Medway, Antio Biotechnologies, the Biological Committee of the Industry Research and Development Board, and the Breast Cancer Network. Past memberships include the Jupiters Community Benefit Trust Fund, Brisbane Water Board, Breast Cancer Association of Queensland. In 2001, she chaired the State Task Force on School Transport Study. Dr. Hirst's significant contributions to education and to medicine have been recognised by 3 important awards. She was made an Officer of the Order of Australia in 1998. She was named Queenslander of the Year in 1995 and received the Jean Harris International Rotary Award in the same year for services to women, the first Australian woman to receive that singular honour. It is fitting that Griffith University should honour Cherrell Hirst AO in recognition of her distinguished service to the community. Acting Chancellor, it is with the greatest pleasure that I present to you Cherrell Hirst AO for admission to the degree of Doctor of the University.
I now call upon Dr. Cherrell Hirst, AO, Doctor of the University, to deliver this afternoon's occasional address.
Acting Chancellor, Mr. Henry Smurden, Vice-Chancellor, Professor Glyn Davis, distinguished guests, graduates, families and friends. Thank you to Griffith University, to Acting Chancellor Henry Smurden and Vice-Chancellor Professor Glyn Davis for this incredible honour which you have bestowed upon me. Spending a lot of my time in the world of universities, I am very conscious of the enormity of this honour, and I am deeply moved and greatly appreciative. I can assure you that in my life and my work, I will endeavour to live up to the standards and the reputations of Griffith University. Thank you. I would particularly like this afternoon to congratulate our graduates. Today is your day. It's your celebration. You should be experiencing the excitement and the joy of success. I wish you continued success and I wish you happiness. Thank you for sharing your day of celebration with me. It is a very great pleasure for me to have this opportunity to speak at this particular graduation ceremony, because you, the graduates of today, symbolically begin your career as professionals and scientists in the world of health services this afternoon. This particular role, or one little tiny part of it, has been the centre of my professional and to a certain extent my personal life for a little over 30 years, working to achieve and promote health. And an understanding of health as I understand it has been, is now, and will continue to be the passion of my life. When I graduated in medicine a little over 30 years ago, professional roles were narrow and heavily prescribed. Services were limited. Doctors and their allied help were there to tend to the sick. Health professionals did not work in teams. Attention to broader patient needs was not on the radar screen. health as a concept was not talked about. The goal was to provide what the doctor defined as cure, or the best possible physical improvement. Patient expectations were to a large extent also limited to physical improvement. Effective communication and information provision about sickness, much less about health, were beyond comprehension. But for you, the graduates of today, it is different, and I believe it will become increasingly different. You will work cooperatively in teams, whether you are scientists or clinicians, whether you work in prevention or in therapy, whether you work with individuals or with communities. Together, right across the range of health-related disciplines, you will provide multi-dimensional care, whether it is for an individual or for a community. And I'm sure you are aware that your professional worlds will become increasingly complex. There will be more science, more technology, more competition, more marketing, more legal issues, greater community, patient, client expectations in terms both of curability and infallibility. There will be, I think, a demand for health, driven partly by a realistic understanding, but also, at least in some part, by misconception, simplistic understanding, and degrees of ignorance. This is the world that lies ahead of you. There are enormous challenges, but there is great excitement and enormous potential. Potential to influence for the better models of care, potential to continue the beginning trend to value the patient or client or even the community as a whole person or people, and the potential to have as an overriding collective professional and community goal to optimise individual and community health and wellness, rather than simply to treat disease. I believe that you, as the professionals and the scientists of tomorrow, have the opportunity and the responsibility to change the current health paradigm forever. You are graduates of the health sciences, you are providers of health services across a large number of domains, and as such your ultimate professional goal must be the improved health of individuals and the community. But what is health? It is very important that we do not confuse concepts of sickness and illness with concepts of health. Sickness is a narrow, negative concept, implying the absence of health in one way or another. Health is a much more difficult concept to define. We are quite good at measuring or categorising significant degrees of sickness through diagnostic means, and we have vast depths of understanding of when the body, and to a lesser extent the mind and the emotions, are not working well. And we can come up with names of syndromes and diseases, and in many instances quite powerful treatments. But do we have any ways of measuring health? There are many, many other questions about the concept of health. Does health exist in a graduated scale, i.e., are there degrees of health even in the absence of sickness? Is health a relative condition? Unlike pregnancy, which is an all or none state, can health be a partial state where any one of us can be partially healthy? And what if we have a chronic illness, even widespread cancer, but we feel, and on all indications may be quite well at any given time? Are we then healthy, or are we not? Dealing with these concepts opens an enormous Pandora's box of philosophic and ethical questions for us as practitioners and for society. But deal with them we must. Where does this dilemma and these questions leave us as professionals, if in our work we are striving for health of individuals and for communities? I have to ask, where are our goalposts? How do we benchmark or set standards? What are our measuring instruments, and how reliable are they? When interventions are needed, what is the objective as far as health is concerned? And if the objective is health, then who decides when it is achieved and how? And there are other questions on a broader scale. How does an individual gain an understanding of health? My answer would be from the accumulation of information each individual receives from myriads of sources across their lives. And that then begs the question, who has the responsibility of communicating a meaning of health to society? I believe that we all do, all of us involved in the health industry, all of us who engage with the community or with individuals in this health domain. Every aspect of health service provision belongs as part of our social framework of health, and the message each one of us sends out about health is therefore important, and the conflicts between different interpretations are confusing and difficult. So it seems we should at least try to define or describe health. Some thoughts from the past. Thomas Fuller said, "Sickness is felt, but health not at all." George Denison Prentice very astutely said, "What some call health, if purchased by perpetual anxiety about diet, isn't much better than tedious disease." And Henry David Thoreau said, "'Tis healthy to be sick sometimes." And Franklin Adams said, "Health is the thing that makes you feel that now is the best time of the year." And my definition, developing after more than 30 years of professional life with healthy and sick individuals, and 15 of those years spent specifically trying to encourage health, an experience consolidated by my observations of people everywhere, even in my worlds of education and business, because people are people wherever they are with the same needs, attitudes, emotions and fears. My definition is that health is an attitude, not a state. An attitude which motivates us individually to seek to achieve optimal functioning of our mind, our body and our spirit every day of every year. And I know that still, even after all this time, that understanding is still way less than perfect. I am still learning about health. Graduates, your courses have prepared you well for much that you will need on your professional journey. But I believe it is your experience now as you proceed along that road which will be your greatest teacher. As you travel, accept that you have much to learn. Stop often to think. Ask questions whenever you have the chance. Observe and learn from your patients, your clients, and your communities. Reflect on your experiences and seek always to understand the meaning and the acquisition of health for yourself as well as those you serve. And know that you can be guided by your own developing concepts of health and illness, of patients' needs, and how you can make a difference. Go on learning in this way through your own professional careers, for in the words of Henry Adams, they know enough who know how to learn. Graduates, congratulations on your success. I trust you will enjoy your rewards. Your future is an exciting world, full of challenges, full of expanding knowledge, which will increase your understanding of what might deprive any one of us with health. Improved diagnoses based on new tests, theories and strategies and intervention for prevention and therapy and devices for just about anything. So much will change in the scientific, technological and social world that by the time you come to the end of your career, you will wonder how you ever managed when you started. But there are things that will never change. The need of people and individuals for personal understanding and dignity. Encouragement in striving individuals to achieve personal change to health and behaviour. Information converted into knowledge through the help of an understanding professional. And assistance in understanding the mystery of the relationship between life and death. I want to finish by reading you the words of a poem by Elizabeth Mosley. When she wrote these words, Elizabeth was confined to a motorised wheelchair. She has an incurable and progressive degenerative neurological disease. She is scarcely able to speak or to move. She called this verse a song of life. Our journey continues day by day. Our earthly experiences, governed by the physical, our spiritual growth, determined by our own will to open our minds to new horizons. The limitless possibilities for development of our inner self, a prospect so exciting, an opportunity too valuable to miss. Each hour of the day a delicate flavour not to be squandered or shattered by pique. Each person we meet impacts on our psyche and touches our lives as we impact on them irrevocably. The length of our stay unimportant, the quality of our evolution paramount, the joy of our maturity profound. That, my friends and fellow travellers in the world of health services, is my idea of health. Health regardless of a physical state. Health regardless of the imminence of death. Health achieved by care, by treatment, by understanding, by patience, and by determination, supported by family, friends, and professionals. By, in this case, an individual working with her many healthcare providers, professional and non. My graduates of today, I wish you a happy and successful future, and I hope that you may meet such challenges in your professional lives with enthusiasm and passion. I thank you.